Okay, so the 6 of us all interned at the Republic County Hospital, and this is our slideshow. I am Frankie Snap. I worked in 2 departments. The first department I worked in was the business office. I learned how to operate the phone facilities, which is extremely harder than you think. And then I actually was able to call a practice code pink, and a code pink is when there has been a baby abducted in the hospital. I learned how to file different insurance company cards, and I also put together admission packets for when the front ladies aren't there. I also worked in the rehab department. In there, I learned never to push to pain. So when you're working with a patient, you have to make sure to be watching their facial expressions, and you also have to make sure to be asking them, is it painful or is it just a soreness ache? A lot of it is strengthening, so you will see a lot of older people in there that just have back pain. So with back pain, you have to strengthen the back, but also your glute muscles, legs, and quads. So you'll see a lot of those type of exercises. And then we did have a patient that had torn her ACL. And with that, we did the BFRT, which is blood flow restriction therapy. So basically, it's a band that you put above the quad, and it tightens. It's almost like a blood pack thingy. What's that called? Blood pressure, thanks. And so it tightens and restricts the blood flow, and it's almost like maxing out on a squat. And you also you have to put it above whatever muscle you're working, and you can also do it for biceps. Okay, so my name's Hannah Martin, and I'm a CNA at the Republic County Hospital, and I also interned in the radiology department, outpatient surgery, rehab, and I think that was it. But for the radiology department, I got to watch Jess right there do cardiac ultrasounds, and I got to see x-rays and CTs. I got to go back and watch an MRI. I couldn't actually go in the room, but I got to watch it through a window. And I got to see a swallow study, which is basically where you put barium, which shows up on an x-ray, on different foods and have the person swallow it, and it shows up on a screen. So you're able to tell if there's any abnormalities in that person's tract. So you can see if stuff starts coming back up, like harder foods, softer foods, thicker or thinner drinks, and also pills. And that's basically it. And I also really like the radiology department because everyone was really nice to me. And for outpatient surgery, everyone was really nice in there too. And I got to see some really cool stuff. Some of it was pretty intense. So I actually got to be back in the operating room for a BKA, which is a below the knee amputation. And as you can see on that picture, I got to watch basically somebody get their leg amputated. I also got to see a carpal tunnel release, which is that far one on the hand. So they open your hand and release the ligament. I got a tour of the operating room and back in surgery, which was pretty cool. And I got to have firsthand interactions with the orthopedic surgeons that come to our hospital to perform these surgeries. So that was neat. And for some of the operations, like the total knees, I had to watch through a window. So there was a small window outside the operating room that I got to watch 2 total knees be performed, which it was a lot harder because people are obviously doing their job. They're standing all around while the surgery is being performed, so it was pretty hard to see most of it. You got to see like here and there a couple things, but when you're actually in the operating room, you're able to move around to either side of the table and kind of look around, so you get to see a lot more and experience a lot more when you're actually in the operating room. But it was still a really good experience to get to meet all those people and watch some pretty cool stuff.
I'm Abby Tuma. I'm a CNA in both the acute and ISB departments, and I got to intern in the radiology department, the outpatient surgery department, as well as the Belleville Medical Clinic. The medical clinic was definitely my favorite department just because it is what most people see when they come into a hospital. I got to follow around the nurse practitioner, and so I got to see her checkups with patients like physicals or post-op exams, like if bandages needed to be redone, I got to watch some of those. We also had a trauma that day, so I got to go to the ER and watch as everybody in the acute floor, radiology department, all worked together on a big trauma. So the intermediate swing bed department is like our nursing home wing. It is in the lower wing of our hospital, and it's where I was a CNA most often. Down there, I get to provide assistance for all the residents, and I get to help make sure that it's comfortable down there. And it's really cool to see all the types of relationships that you get to have with all the patients, because we only have about 10 patients down there, so you really get to get personal with all of them every time you get to work there.
My name is Connor Martin, and on Mondays I would go and job shadow, and then Tuesday, Wednesday, Thursday I would go and help engineering, which is maintenance. One of my first weeks there, I had to replace 3 benches outside, and I made all these from scratch. It was really hard because I never really made anything. So as I went, each one got a little bit better. I also stained them. But I learned a ton there, and I met some really good guys, and I loved to just hang out with them during breaks. We always would talk, and it was really different because they're a lot older than all my other friends, but that was good. I'm gonna go to the next one. I also got to job shadow pain management on one of the Mondays, and most of it was just back pain. So what they would do is try to get relief for the patients. They would first talk to them, make sure they're going into the right spot for the pain. Then you'd get on the table and they would clean the area, then put in a numbing shot, and then do dye, which like Hannah said, it shows up on the x-ray, and that's to see that the steroid will go to the right spot. So after the dye, they put in the steroid, and then it's done. So that only takes like 20 minutes, and I got to watch 5 or 6 of them.
I am Tracer Murdoch, and I actually got to shadow in almost all the departments, but one of them I got to shadow was the EMT department. So EMTs, they're obviously the first responders, if you have an accident or an emergency, they're the ones that show up. So they do a lot of stuff, and they do a lot more than just like medical emergencies, They do a lot of rescue stuff. They also do a lot of community building stuff to help you stay aware and know what's going on and when there is an emergency. When I was there, unlike Connor, I didn't get a lot of transfers or calls, but we did a lot of training exercises. I learned how to tie a lot of ropes and knots in case I ever need that. Of course, they need that a lot in rescues and fires. We also did a lot of role-playing stuff. So say Billy fell over and he's dead, you got to save him. So we did a lot of training exercises, but it was really enjoyable, and I got to learn a lot of stuff about that. So
I'm Sarah Portnier. I'm also a CNA on the acute floor at the Republic County Hospital, and I also got to intern in multiple departments there as well. So on the acute floor, we provide short-term, time-sensitive care. So patients are usually recovering from an illness or a surgery, and the care is provided based on different patients' needs. So if you have somebody that comes in with COVID, they're going to be on a higher level of isolation rather than a patient that's just in because their knee hurts or they had knee surgery or something like that. So the nurses give different types of medicines when needed. So somebody might need oral medication for something, or they might need IV medication. And then the nurses' aides also provide care for the activities of daily living. So you may help someone get dressed, or you might help assist someone to the toilet. You might help them take a shower, or you might ambulate them in the hall. So multiple patients, you can either have 1 assist, 2 assist, independent, or full body lift. So if they're independent, usually they don't have a light on by their door, so they just kind of do whatever they want. They won't have alarms on. If they're a full body lift, a lot of times they have alarms on because you have to be with them to put them in the sling. If they fall out of bed, like, they can't help themselves. And then you're 1 to 2 assist. If you have 2, obviously there's going to be 2 aides, and then if there's 1, usually it's just 1 person in there. Thank you.